Dementia, commonly referred to as senility, is a clinical syndrome that leads to a permanent decline in cognitive abilities. This condition affects memory, language, thinking, reasoning, and social skills, significantly impacting a person's ability to carry out daily activities. Dementia occurs as a result of the loss or damage of nerve cells in the brain and is progressive in nature. Dementia can affect one or more areas of cognitive function. Memory, attention, language, problem solving, and even personality may deteriorate. The most common cause of dementia is Alzheimer's disease. Other types of dementia include vascular dementia, Lewy body dementia, and frontotemporal dementia. However, dementia is not a single disease, but a general term used to describe the decline in cognitive abilities caused by various underlying diseases. What is the difference between Alzheimer's and dementia? Alzheimer's is the most common type of dementia. However, dementia is a broader term that describes the decline in mental function. It encompasses a variety of diseases that result in brain cell damage and cognitive decline. Alzheimer's disease is the most frequently encountered and typically begins with memory loss, confusion, and behavioral changes. Other causes of dementia, such as vascular dementia, Lewy body dementia, etc., may have different symptoms and progression patterns from Alzheimer's, but they all lead to similar cognitive decline over time. After explaining the difference between Alzheimer's and dementia, let's now answer the question, how many stages does Alzheimer's disease have? Since Alzheimer's disease is progressive, it is typically classified into three main stages: early stage, mild stage. This usually encompasses the first 2 to 4 years of the disease. Middle stage, moderate stage. This stage spans 2 to 10 years. Late stage, severe stage. The final stage, which can last an average of 1 to 3 years. Each of these stages presents with different symptoms, and the care required for patients changes accordingly. Now let's move on to early stage Alzheimer's symptoms and recommendations. In the early stages of Alzheimer's, a person may have difficulty remembering recent events. For example, they might start forgetting recent conversations or recent events. They may frequently ask the same questions or repeat conversations. There may be slight declines in concentration and problem-solving abilities. They might struggle to find the right words or to express themselves. They could experience minor issues with using tools or writing. Personality changes, depression, and anxiety may appear. They may find it difficult to learn new skills. Here are some recommendations for individuals showing early-stage Alzheimer's symptoms. Physical activity. Mild exercises and walking can have positive effects on brain health. Cognitive engagement. Activities that keep the mind active, such as solving puzzles, reading books, or participating in social activities, can help slow cognitive decline. Balanced diet. A diet rich in omega-3 fatty acids, vegetables, fruits, and whole grains can help protect brain health. Support groups. Early-stage patients and their families can benefit greatly from support groups, which play a crucial role in managing the disease and adapting to it. Mental challenges. Engaging in strategy games or learning activities that challenge the brain can help maintain cognitive function. After providing this information, let's move on to middle-stage Alzheimer's symptoms, which covers the 2 to 10 year period. In this stage, past memories and learned information begin to fade gradually. Memory impairment becomes more noticeable, affecting daily life more significantly. There may be disruptions in time and space perception, increasing the risk of getting lost. The patient may begin to have difficulty recognizing familiar people. They might struggle with a sense of direction and cause and effect reasoning. Behavioral changes, such as delusions, paranoia, such as accusing others of theft, and recounting imaginary events may occur. Assistance may be required for daily activities such as dressing and eating. During this stage, the need for assistance in daily activities increases, so regular professional care or family support becomes necessary. Daily routines can be created to strengthen the patient's orientation and reduce anxiety. Safety precautions, such as locking doors and using tracking devices, are essential to prevent the patient from getting lost. Medications prescribed by doctors can help alleviate symptoms and slow the progression of the disease. Patients may become more emotionally fragile during this stage, so a patient and understanding approach is crucial. Now let's move on to late-stage Alzheimer's symptoms and what needs to be done. In the late stages of Alzheimer's, the distinction between past and present blurs, and the patient struggles to recognize familiar faces. Severe communication difficulties arise, and speech may be lost entirely. Swallowing difficulties, incontinence, urinary and fecal, and other physical symptoms may occur. Loss of physical strength, becoming bedridden, and an increased risk of falls may be observed. Severe psychiatric symptoms, such as delirium or hallucinations, may occur, and patients may become completely dependent on others for care. At this stage, patients require 24-hour care. Professional caregivers or nursing homes may be necessary for support. Due to swallowing difficulties, special feeding methods may be required, such as soft foods or liquid diets. Patients become more vulnerable to pneumonia and other infections, making hygiene and care measures essential to reduce infection risks. At this stage, treatment options are limited, so the focus should be on increasing patient comfort, managing pain, and taking soothing measures. This period can be very challenging for family members. Support groups or psychological counseling services can be beneficial for both the patient and caregivers. In conclusion, while Alzheimer's is a progressive and devastating disease, the quality of life for both the patient and their loved ones can be improved at each stage with proper care and support. Early diagnosis plays a critical role in managing the disease. Therefore, recognizing early symptoms and seeking professional help is of great importance.